All right, we will go ahead and get started. Hello, everyone, and welcome to the MDH Stroke Program's education series. With Stroke Awareness Month of May just around the corner, we wanted to share a few stroke awareness resources to hopefully give you some ideas on what to consider this year at your own sites. But most importantly, today we are excited to hear from our special guest presenters, Elise and Tracy from the Minneapolis VA Healthcare System. Before we get started, I'll cover a few tips to navigate Teams. Today's webinar is being recorded and will be posted to the MDH Stroke YouTube channel following the session. All participant lines and videos have been muted upon entry, but please feel free to ask any questions at any time by typing them into the chat. We'll track questions throughout the presentation and aim to address them at the end or in a follow-up email. You can also interact with our presenters by using the reaction smiley face icon, and live closed captioning is available in Teams. To turn captions on or off, go to the meeting controls at the top of your screen, select More, and then navigate to Language and Speech, and then to turn off or on live captions. And here is our agenda for today. We'll begin with a few stroke program updates, review the learning objectives, and highlight resources available on the MDH Stroke website. Then I'll hand it over to the VA team to share their stroke outreach and awareness efforts to enhance veteran stroke education in an engaging way. You'll receive 0.75 contact hours upon completion of this training and corresponding evaluation. The evaluation link will be provided in the closing slide. All right, so just a couple stroke program updates for you today. Minnesota Stroke Association Stride for Stroke Walk. This is a really fun event that brings together stroke survivors, caregivers, and supporters to help raise awareness and funds for programs that make a difference in the stroke community. This event will be held on Saturday, May 16th at 10 a.m. Walk locations are in Twin Cities, St. Cloud, and Duluth, as well as virtually. And the MDH Stroke System Striders, our small team and mighty stroke team of 3, will be at the Twin Cities Walk again this year. If you are a acute stroke ready hospital stroke coordinator, and you were up for designation this spring, thank you for recently submitting your application in the Minnesota Stroke Portal. No news is good news. The next step is waiting for an email from Michelle to schedule your site visit. Also, stay tuned to a spring calendar invite for a special Acute Stroke Ready QI opportunity. And you can contact Michelle with any questions related to all things Acute Stroke Ready designation. All right, here are our learning objectives for today. So the first one is to access MDH Stroke Awareness Campaign resources. The second, identify strategies for planning successful education fairs and awareness campaigns through interdisciplinary collaboration, community partnerships, social media, and online tools. And third, apply creative, patient-centered strategies to stroke education events using evidence-based tools like BFAST for stroke recognition. So let's start with the MDH Every Second Counts public awareness campaign. Our BFAST messaging may be recognizable to you as it is how we brand our swag from magnets to grocery bags and our stroke awareness materials from posters to bus ads. And the Every Second Counts Stroke Communications Toolkit houses a wide variety of awareness strategies, including media releases, advertising, social media, and materials. The materials are in the form of graphic files that are free for you to download and print in multiple languages, including English, Spanish, Hmong, and Somali. And here's a peek at what those images look like. There's an infographic, newspaper ad, social media graphic, billboard, poster, and bus ad. And these can be used on magnets as well. Each image has a place for your organization's logo or website, and each image has 2 versions, one with and one without the MDH logo. And the Every Second Counts campaign materials are available to any healthcare organization across the state, including those who serve Minnesota patients. And to access the toolkit, you can visit our Every Second Counts public awareness webpage and click on the link that says Stroke Communications Toolkit. And then next, using the link provided in the toolkit or on the same webpage, find and click on the Every Second Counts Toolkit request form, which is in the order form to access the free graphic files. And we'll put those links directly in the chat for you today. The form will ask for basic information about your organization and how you plan to use the materials. Once submitted, the form will direct you to a link in a Dropbox folder where you can download any and all files to print to start using right away. And you can contact our team if you have any questions or need any kind of support. And then we also have cardiovascular risk factor reduction handouts and videos through a partnership with Hispanic Outreach of Goodhue County, Kaleidoscope, and the International Oromo Health Professional Association. MDH created videos and handouts that cover the most common risk factors that can lead to a heart attack and stroke and how to change them. The videos are available in Spanish and Hmong, and then the handouts are available in English, Spanish, Hmong, Somali, Oromo, and Amharic. And then here's a snapshot of what those handouts look like. And then another resource for you to check out is the newly developed self-measured blood pressure one page, which is available in English, Hmong, Somali, and Spanish. This guide has tips to establish a practice taking your blood pressure at home and resources like finding a validated blood pressure monitor as well. And then one final resource I'll highlight today is the Be Fast materials from the American Heart Association, which also includes resources on preventing a second stroke. We hope these materials will be helpful for you to use in your work and share within your communities, and hope you have a successful stroke awareness month of May as well. So now I'm happy to welcome Elise and Tracy from Minneapolis VA Healthcare System and turn the presentation over to them.
Hey, thanks for having us. As Jamie said, we are here from the Minneapolis VA Healthcare System to showcase our veteran stroke awareness outreach. Our healthcare system serves more than 100,000 unique patients and consists of the medical center, 13 CBOCs, which are community-based outpatient clinics. There's one CRRC, which is our Community Resource and Referral Center, which is homeless services and a mobile medical unit. We are CMS 5-star quality rated 2 years in a row, and we pride ourselves on our food insecurity initiative programs to end veteran homelessness, suicide prevention, and we are home to the largest and most active research programs in VA. The medical center, which is pictured there where Tracy and I work, is a 301-bed acute care hospital with 4 primary care clinics and over 50 specialties. We are a VHA designated primary stroke center, and we were the first VA to use Tenectaplace. Next slide, please. We have no financial disclosures, and the opinions in this presentation are ours and not necessarily those of the VHA or the Minneapolis VA. Next slide, please. So we are just hoping that you'll come away from this webinar able to identify strategies for planning successful education fair or awareness campaigns by incorporating the interdisciplinary collaboration, community partnerships, social media, and online tools. And we want you to be confident in using creative ways to apply evidence-based tools like Be Fast stroke recognition for patient-centered stroke education events. Tracy, take it away.
Thanks, Elise. Thanks again for having us here this afternoon. Can you switch to the next slide, please? So one of the things we thought Elise and I thought would be helpful is to get some feedback from all of you, just what are the biggest barriers you have had or may have when trying to do preventative outreach? So if you were able to have any feedback to put a comment in the chat, it's nice to kind of know where people maybe have been or started or what they anticipate as a barrier. Budget, the people, yeah. I see money coming up quite a bit. Yep. Participation, cooperation, yeah. Those are great. Yep. Time constraints, staff, yeah. Those are all legitimate things that I think Elise and I have also dealt with and tried to work around or get creative. So, okay, perfect. Can you transition to the next slide for me? All right, so one of the things, actually, can you do me a favor and switch to the next slide, 19? All right, so this seems like it might be a better place to start on this slide since we're, getting the feedback as far as what are some of the barriers. So I noticed one of the things that people mentioned was money, budget. Yep, sometimes it takes a lot of extra creative resources to be able to put on a fair or put on anything that involves printing any of those pieces, any kind of swag, staff resources. I know Elise and I, it's her and I, and so we have to rely and have been able to kind of recruit other staff to help us with some of the pieces. We don't have to do it all ourselves. Using in-house clinics, so also reaching out to other clinics within the VA to see if they can help us. Also reaching out to other community stakeholders. The biggest one is space, like where would we hold it? I'm not sure for some of your folks too with in the rural hospitals, how do you access people that maybe don't come into the clinic, or how do we outreach to some of those outpatient clinics as well? So if you could go back to 18, I'd appreciate it. Sorry. All right. So setting the stage, these are some of the things that Elise and I were starting when we started this to think about, like, what's the target audience that we're trying to reach? Maybe it's something small. So like I work inpatient. So we started doing some outreach and some education on the unit. And then we kind of branched out to have it spread into the hospital. And then we went to the fair. So we kind of started small and things got a little bit bigger as we went through time. So this, we first started some of the outreach and really honing in on the preventive education, at least from the inpatient, about 4 years ago during COVID, and then things have just really blossomed. So we did we started small, and then we really wanted to figure out what was the main message that we're trying to send. So her and I's focus has been stroke prevention and the Be Fast and getting out just the basics of what to look for stroke, risk factors, what are signs and symptoms, and what to do. And then what were the barriers? So reaching people, how to get people to attend, money, all of those things. And then another thing that we were considering as we do this every year, thinking about what other areas, here have other programs done something. Sometimes you don't have to reinvent the wheel. So we have some other areas and programs that they have done similar. And so we kind of piggybacked from that and kind of picked their brain. That there was our AMP program, they do a fair. And so we're like, maybe we should try something like that. So sometimes looking at what other people have done and learning from them, like what's worked, what hasn't worked, was helpful. And then even if you have a few other people that have a similar passion or are interested in trying to get the word out with whatever your message is, to do a small work group. And then help, because two heads are always better than one or three or four, to really brainstorm kind of how to put it together. So these are some things that we started, things to consider, things that we kind of do ahead of time as we've been planning. Some of it's a little bit more organized because we've we've had a few years under our belt, but initially these were some of the things that we really started to think about as we were trying to, get the word out and really reach veterans about stroke prevention and Stroke Prevention Month. You can switch to the next slide. And the next one, please. So once you kind of have some of the barriers and some of those other pieces figured out, like what your message is, who's your audience, then and if you know what your barriers might be, then figure out what sort of platforms you want to use. Do you want to try to have an in-person? Do you want to try to get information out over social media? Like, what are the different platforms that you would like to try to reach as many of your population as you can? Having things displayed throughout the hospital. We've done that, and we do that every year. We have TV screens throughout the VA, and we literally will have revolving sign up there about stroke prevention and what are the Be Fast signs. So just getting people to see it. Maybe they're sitting in pharmacy waiting to get their medication, or they're sitting in the main area of the main atrium of our hospital and they see that. So even something like that is a good way to reach people. And again, I mentioned a small group, a work group. Get those people and that can help you figure out how to get that message out. And I think people are wanting to help get the word out, especially if you're working in a group like we are with the other staff and interdisciplinary team that know about strokes, treat people with strokes, and they want to try to help provide that education. The next one is sometimes you got to think outside the box, get creative. And Lisa's going to show something that she created, our stroke casino, which has been a huge hit. But that's something that she got creative as a way to catch people's attention, to get that education out. Also see what other programs have done as well. Sometimes we can learn from other ways, swag, snacks, things, anything that will kind of bring people in, like when we've done the fair. Again, find out from them, like what were the difficulties? What were some things that maybe they would have done differently, or things that worked? And then, so during this phase, you're going to start to kind of utilize your team, utilize those community resources to help you really figure out kind of what that first step is, depending on what platform you're going to use. And it's okay to use more than one. Next slide, please. So kind of as I've been talking, how we evolved. So the first time we did this, we had small things. We had like table tents that we put in primary care clinics. We had some signs up on the unit. So we had the TV screen. So we kind of really started small. And then we had a storyboard as well on the elevator. So maybe that's a way to reach, all patients in your hospital. If there's a main area where you could put during the month of May, stroke prevention, signs of a stroke, what things to look for, and maybe even some resources within your hospital for stroke. That might be a good way just to put it out there. That might not be too much, cost too much, or too much staff time, because sometimes if you have other duties, these are all kind of extra things that we do. Again, if there's a TV screen or any other place to put information, that we put that up and it's visible all month of May. And then as we've gone forward, the last 3 years, we started, in 2024, we did the first stroke prevention fair, and that was a huge hit. So we've been doing that, and then Elise added a stroke casino, which I will let her talk about that because it's fabulous. So I guess, the point we wanted to make is it doesn't have to be a huge fair. You can start small and then kind of build from there. Anything that you feel is going to engage people to get the most amount and what's within your time frame and your means. Next slide, please. So these are just, again, I wanted to show you like the table tents. We had put those throughout the hospital. So we had them in clinic waiting rooms. One year we put them down in the dining room. We just kind of spread them out throughout the hospital, and it's the Be Fast sign. So just a simple way to get the message out. And then the storyboard is the other one that we have that we put through the month of May as well. And I feel like that can be a good way to get information about stroke prevention, signs of a stroke, what to do, but also maybe a way to advertise what services or programs that you might have in your hospital or clinics that people can use all year round. If you've got a diabetes class or hypertension, anything that can kind of help guide them towards other follow-up care for those stroke risk factors. Next slide, please. And so this is just our fair day. Last year we had 170 participants. And so I've got a list of all the educational booths that we have within the VA. Our rec therapy, they did a great job of like adaptive sports. There's Lisa's Stroke Casino. We had diabetes education, our integrative whole health, occupational therapy. And it was 2 therapists on our team, and they're amazing, but they had a whole table of like different adaptive equipment, nutrition, advanced care planning, even just helping people, hey, have you thought about a healthcare directive? Trying to reach them on multiple different health issues. We had a blood pressure station, our caregiver support, our sleep apnea clinic, which is a huge, because a lot of our veterans have sleep apnea. So that was a huge hit. My Healthy Vet, helping people get enrolled in their online healthcare portal. And then we also had people from the Stroke Association, Stroke Inspire, the Health Partners Group came, and then MinCan came. So we've got some other community providers that we've partnered with that also come in and have a table there. And the swag, you can never go wrong. You are able to even give them snacks, water. People love free stuff. I love free stuff. If there's food, I'm all about that. So anything to kind of just get people to come in. And we try to do healthy snacks. I know it's kind of, if you're, hey, watch your diabetes, but here's a piece of candy, doesn't always work, but we try to get creative. Next slide, please. And again, so this is just some pictures from the fair that we have. There's Elise with the Stroke Casino. We have the diabetes table, so all good information about sugar, kind of how much sugar is in soda. There's Brian with our blood pressure station. Trang, our occupational therapist, the equipment that she's going through. We had MinCan, and then our caregiver support program. So just a sample of some of the tables that we have at the fair. Next slide, please. All right, Elise, you're up.
All right, thanks. So for Stroke Awareness Month, I wanted to create an attention-grabbing, interactive, theme-typed education station that addresses all the aspects of stroke care. Risk recognition, emergency activation, in addition to how the VA can partner with them to help reduce whatever risk factors they're willing to work on. So if a veteran isn't willing to quit smoking, maybe he is willing to take a 10-minute walk every day. Or if he isn't wanting to give up his nightly ice cream, maybe he'll monitor his blood pressure in the morning. Small changes that they are willing to make so it doesn't feel like we're trying to take something away from them, but giving them the informed control over their health decisions. So I toyed around with a couple of themes. I thought about like a mystery theme, like a clue game or a Sherlock Holmes. And I also thought about maybe a geographical adventure, like in the line of like where in the world is Carmen Sandiego. And I thought about an outer space theme, but I would be very uncomfortable in a spacesuit for 5 hours a day. So I settled on the Stroke Casino, learn how to lower your odds, because who doesn't like winning? So I started kind of sketching the games and how I could link them to something stroke related, and it just kind of snowballed. So first, in the middle there, I designed like a poker blackjack kind of game, which included chocolate poker betting chips that I found on Amazon. And because 80% of strokes may be prevented, I wanted to address the risk factors. So you can't control the cards you're dealt, so it's up to you to manage the things you can. Know your insurance options. The cards have both common and more rare stroke risks, and we just kind of deal some out randomly and discuss whatever card the veteran is interested in talking about. And because lifestyle factors account for nearly half of the global stroke burden, I had more of those risk cards. Veterans are at a higher risk for cardiovascular disease than the general population, so I linked specific risk factors to one of the great programs that the VA offers to address those specific risks, like our blood pressure groups, our weight management group, our healthy teaching kitchen, tobacco cessation, addiction recovery, diabetes, and everything. I mean, I could tie it all into the casino and their risk. I wanted them to know whatever their risk factor was that they wanted to work on, that the VA has a program for that, and we got your 6. And then up in the top corner there where Tracy and I are pictured by that wheel, I built this roulette wheel out of some wood scraps that I had left over from a home project. And I used Canva to design the brain. And for those of you that don't know, Canva is a free graphic design site. I use this for so many projects because I can't even draw a straight line. So I definitely get my money's worth out of that free site. And since stroke is the #1 leading cause of disability among adults, and every stroke is different, I wanted to show that stroke effects vary depending upon what part of the brain is affected. So the wheel is 2 hemispheres, and I placed random dots that correlate with a disability that could occur if that part of the brain was affected. So they would spin the wheel and we'd discuss possible disability associated with that area. So like if they landed on a dot in the left temporal lobe, we could discuss that a stroke in that area could leave someone with impaired speech or poor memory or a paralyzed right arm. Or if they landed on a dot in the right parietal lobe, maybe I'll bring up that someone with a stroke in that area could be unaware of their left side, you know, only eating food on the right side of their plate, or have poor spatial awareness and, you know, walk into things on their left side. And there's even a dot labeled TIA. You can see that, maybe you can't, it's off the brain. And we talk about what a mini stroke is, and that it can have the same symptoms as a stroke, but it usually just lasts minutes and it doesn't cause long-term damage. But that it should also be taken very seriously because it's a warning sign, and about 1 in 3 people that have a TIA will eventually have a stroke, and half of those occur within the first year. So I tell them, you know, nearly half of all strokes include some kind of degree of mobility deficit, and then I end on the good news about neuroplasticity and how the brain can make new connections and restore some of the functions, and that is why it is so important to recognize the symptoms and be fast.
Cherry fluff.
We got to open mic.
Cherry fluff sounds good.
Which leads me to the Be Fast game, and that's down in the bottom corner there with the 911 on the thing. And that's a dice game. It's like, if you remember the shut the box game where you know, roll the dice and shut the numbers. I took a blank red dice that I got on Amazon and put a letter from Be Fast on each side, thanks to my sister-in-law and her Cricut. And in this game, they rolled the dice, and we talked about the signs of a stroke that corresponded with the letter that they rolled, and then we would shut that panel. So if they rolled an S, we would talk about that S is for a sudden change in speech. It could be slurry speech, it could be jumbled speech, it could be confusion, hard to find your words. And then they would close that panel and then roll again. And once they started hitting a lot of duplicates, then we just kind of flip them down and talk about what that letter stood for. And with our patient population, we really had to focus on the T for time piece, because our guys are tough. They were taught to pull yourself up by your bootstraps and tough it out. And we have to drill into them that this is not one of those times. That every minute without oxygen, almost 2 million brain cells die. We tell them a sudden onset of one of these symptoms might not be a stroke, but it might be, and that's why it's so important to be evaluated, because the treatment window isn't very wide. We also, with our guys, need to reiterate that this isn't the time to drive yourself to the ER or wait for your wife to get home. It's a medical emergency and you need to call 911. We talk about the benefit of the evaluation they get from EMS, the ability to get them the treatment in motion, you know, starting IVs and ruling out some of the other things. They can call ahead to inform the hospital, and the ER will be ready and you can bypass the waiting room which in some of these places, you know how long those waits can be. And then we gave away BFAST magnets and wallet cards for them to take with them. Shout out to my incredible Genentech rep. If you're even here, you might be. And the hundreds of people that played that game, only a few people ever really actually won. It's really kind of hard. We gave out some red BFAST tote bags for all their VA information and flyers and brochures. For the risk cards they could take with them and fill out with their very own BFAST pen and discuss their self-identified risks with their doctors. And it was all very interactive. I dressed like a dealer, and because our medical center is both inpatient wards and outpatient clinics, we have a lot of veterans just kind of milling about throughout the week. So last year I booked a prime location near the coffee shop, lots of traffic. I had 12 volunteers to help me staff the booth throughout the week. I used the Sign Up Genius. It's a free app online, and I created a casino theme, of course, volunteer request that I sent out by email and Teams, just asking people to, volunteer for like a 1-hour slot. And it has been very well received. Last year, we had 675 veterans, caregivers, visitors, and staff stop by, and I'm expecting an increase this year. Next slide. At the end of the table, I had an anonymous short survey that they placed in a box that looked like a dice, of course, because you have to kind of tie it all together, to evaluate if the Stroke Casino Learn How to Lower Your Odds was meeting the objectives I had intended, and we received outstanding feedback. Those are some of the comments that they just kind of wrote in on their cards. Next slide, please. So some of the lessons learned. The survey showed that we need to focus on the symptom recognition. So I think this year we're going to make sure every tote bag gets a BFAST wallet card. And then we've also added more BFAST table tents to the waiting areas and cafeteria tables. And then for May, we have added additional information posters to our On the John advertising in the restrooms. And then another survey topic where our numbers weren't quite as high was the question about initiating an emergency response. And I think maybe rewording it to who should you call or what should you do if you suspect a stroke may invoke a more accurate response. I think they just maybe weren't understanding the question. Additional resources. Like Tracy said, it's important to partner with your colleagues. There's so many resources available to veterans that can link back to the stroke awareness. Last year, we added the sleep apnea. That was our first year with them. And they set up information and equipment and how to get connected with them. And now we include their brochure at the casino because, studies show that obstructive sleep apnea is present in 60 to 70% of stroke patients. Next, we sent thank you notes because we think it's important to show gratitude because none of this would have been possible without a team. And we wanted to share the impact that was made because of their passion, commitment, and time. And swag. Swag is king. It draws them in. So they come in and we get to work our education. And as the VA, we can't solicit or accept donations. But we have a CDCE, which is the Center for Development and Civic Engagement, which partners with community organizations, and they were able to support veteran activities and programming, and they have been fabulous. Timing the event. The Stroke Casino goes all week, but the Stroke Awareness Fair, we wanted to make sure that it hit the most popular time and day to attract the largest audience. Mondays are busy clinic days and a lot of last minute clinic appointments. So veterans come early and often have time in between their appointments to enjoy the complimentary roving coffee carts or a bargain lunch. And experience has shown us that Fridays are quieter and the weekends can be like a ghost town. So we run our stroke fair on a Monday. Identify other outreach ideas. We keep adding novel ideas to reach our patient population, especially in the more rural folks. Like Tracy said, we provide posters and table tents to our standalone clinics. And I think next year I'd like to partner with the community and extend our education materials to some of like the VFWs and some of the veteran county service transport. So I think we can get it even further out there. Staff education on the bottom there. So we've seen that staff is also interested in coming to our events, see what's going on with the VA as it pertains to stroke, and they've been stopping in on their breaks. So we've been introducing a little bit of staff education each year to promote our quality initiatives. Last year we gave out Be Fast badge buddies and education that nurses are empowered to call stroke codes. We also had the QR code that links to the Keep the Brain Alive in 45 game, which is fun and includes CEUs. And then we also had a little Go Red, those little dress for women's health. And this year we will include education on the RAS3 swallow screen. Next slide, please. So we added a couple of new partners to the fair this year, including the MOVE program, which is a direct schedule clinic that provides veterans with up-to-date approaches for weight management and goal-setting guidance and support to make healthy behavior, nutrition, and physical activity changes. And we also invited the Patient Education Library to help answer some stroke questions and direct veterans to VA resources for any health concerns, either on site or in our patient library or online at the VA website for those tech-savvy veterans. We also did a military radio interview. It aired live, recorded on 11:30 a.m. last weekend. And we discussed risk factors, recognition, emergency activation, acute stroke care, and acute rehab. And it was a 1-hour interview broadcast to 72 radio stations, and it's also available on podcast. And we're hoping that we are able to reach some of these guys that don't often make it onto campus. We also published an article in the VA Insider to highlight one of our veterans' stroke journeys. 170,000 veterans, families, caregivers are enrolled to receive this newsletter in both electronic and print versions. And we are lucky to have one of the nurses in our fantastic acute rehab unit volunteer to do the interview and write the article. Thanks, Carrie. Sarge is our stroke book. It's a new national book that provides all things stroke education, and we are currently busy adding our local VA resources. And this will eventually be given out to all of our acute stroke patients during their hospital stay. It'll also be available in our patient library for anyone else that's interested. And lastly, I think, is the World Stroke Day, October 29th. I set up for the day in the big atrium when you first come in, alongside 2 life-size banners with stroke facts and Be Fast. And I give out wrist cards and I talk stroke to anybody who will listen. And last year I had 100 folks stop by. So we're always looking for ideas to make it bigger and better and a more far-reaching impact. Next slide. Thank you guys so much for having us. Looks like there's a couple of questions.
Yeah.
Do we have a budget that
awesome.
was approved, or do we get finances? So like the stroke casino, I just created on my own with some kind of scraps around the house. And I probably had maybe 50 bucks into it, maybe 60 with the vest I got on Amazon. But we have our CDCE, which is our community voluntary services, and they partner with outside organizations, and they're able to provide us with some funds. And I think at the fair, most of the tables that were set up with our partners, they figured their own out.
The other piece too, we've relied on like our medical media that we have. If there's something similar in your setting for like the posters or the signs that we've had, also someone in our public relations has helped us with the website. So I think really the only thing the budget wise that we've really had to kind of use is for some of the swag and some of the free stuff that people have when they come in. But I know at the beginning too, like we were using our own funds to, like I was buying tablecloths off of Amazon, so I think things have evolved. But if there is a medical media or public relations person in the hospital, they can maybe help you if you're thinking about even starting small, of how to put some posters up or how to put stuff up on your website for stroke prevention. Elise, do you for the badge buddies? Can you answer that one?
Yeah, I just put it in the chat too. We got those from our fantastic Genentech rep.
Okay.
Awesome. Thank you. If anyone has any more questions, please use the chat to put those in there. Awesome presentation, Elise and Tracy. I love all the creative ways to get stroke awareness messages out there. It was a very engaging presentation, so that was great. All right. And if you have any more questions, please feel free to continue using the chat, put those in there. But we also have a QR code that you can scan, and it will direct you to the survey for the contact hours, or you can click the survey link in the chat that Michelle will put in there shortly. If you are watching the YouTube replay, please scan the QR code and expand the description box and click on the survey link for your contact hour. And before we close, I would like to extend a very warm thank you to Elise and Tracy for sharing about your education fair and awareness campaign. And to everyone else joining today, thanks for all you do. Please stay tuned to your email for the next educational opportunity. Thanks, everyone.